joining us on Three Women, Three Ways. We are the show that tackles some pretty tough topics sometimes. Sometimes they're not so tough, but they're pretty interesting. And I think that's today's category. I kind of got interested in Andrea earlier this week, actually, because I'm a member of the State Psychological Association, and I saw an email from the association saying that this woman in the Boston area was compiling a list of women-owned behavioral sciences businesses.
I own a practice called Commonwealth Psychology Associates in Boston, and we have about 60 employees, including 35 full-time psychologists, psychiatrists, and neuropsychologists, with 3 locations. So it's gotten quite large, and we serve about 2,500 clients a year, and so that's how I came to be here today. Was really just seeing a need for myself as a professional and also for clients, and I think it's worked out very well.
When we're looking at the business of providing mental health services or behavioral health services, is it different there between men and women?
I think it's different on a number of levels. At the more directly working with consumer level, one of the things that I've seen is that, generally speaking, it's not true for everyone, but in general, the women in our practice at least, and I think it's true across most behavioral health providers, have a little more trouble dealing directly with the finances of therapy or treatment. They're a little bit more uncomfortable asking for co-pays or expecting to be paid for late cancellations, for example. I think men are a little bit more comfortable with that. But I think, and a lot of women are just not starting practices. And a little bit of data that I've gotten back from my request, we're seeing pretty much what you see in women-owned businesses, more generally, even outside of behavioral health, which is women are starting them, but they're not getting especially large. In general, in the general world, outside of behavioral health, women own about 30% of the private businesses in the United States, but only about 2% of those ever reach $1 million in revenue, which sounds like a lot of money, but it's not a lot of money for a small business.
No, it's not.
We're seeing that mirrored even in behavioral health. So,
is there something you suspect about women and our comfort levels with large organizations that might have something to do with that, or do you see it as a business skill or interest issue? How do you explain that?
I think what we see in some of the organizations out there that are designed to help women grow businesses and try to do better is that women don't necessarily have the know-how. They don't have the same access to capital that men do. And I think that some of Sheryl Sandberg's work shows that unless women feel 100% qualified to do something, they're less likely to take a chance and try to do it than men. So
do women ever feel 100% qualified to do anything?
Well, I don't know about that, but they, relative to men, need to feel more confident to take a risk or to try something out. And I think when they have a little uncertainty, that they're more likely to sit back and to not lead in, and therefore not move ahead. And they also just don't have enough role models out in the world or access to them. And actually, that was part of what prompted me to try to start collecting some data about who the women are out there that own practices in general, and specifically to try to identify some of the women owners of larger practices. And a lot of the emails that I got from this particular request, and for many years I frequently receive email requests and phone calls from other women practice owners and men wanting consulting or some help or direction in what to do with their practice. And I think it's not obvious where to go to get that kind of help because, to my knowledge, there is not a directory anywhere of group owners and certainly not broken down by women owners or the size of businesses. And so that's really what prompted me to do this, was to try to get a collection of these people where maybe they could form some sort of community on a Google Groups or a Facebook page or something where we could start to get all of these women together and connected to start having access to more resources. Because I think what happens is there are a lot of talented entrepreneurial women out there starting businesses, and they have 2 and 3 and 4 employees, maybe some have 10. But, they didn't go to school to run a business necessarily, and they're kind of learning as they're going. But I think they're recreating the wheel, and they're making mistakes that they might be able to avoid if they had access to someone to help them who's sort of already been there and done that and made those mistakes. And that was a big part of why I am still trying to get this list of all of these practice owners together.
Mm-hmm. Do you think that women, and I hate making big generalizations, but I think that sometimes we can, do you think women juggle so many balls that having a huge corporation under their, to develop maybe, I guess what I'm saying is maybe some women purposely don't make the huge leap to, a large business because they have so many things to do and they want to keep it small and manageable?
I think that's true for some women. I don't think that is true for all women or explains the things that we see outside of behavioral health in the larger world about why there are so few women on corporate boards and things like that. So I think it's true for some women, but I get so many emails and contacts from women, and even the 50 or so people that have contacted me already just from earlier this week have been saying, I'd love to, be on some list, or please tell me what you find out. I would love some more help. And so in my experience, at least the ones who contact me or have responded to me, people really are looking for help running their businesses better, making them bigger, and they just don't know where to turn. And I think they're spending a lot of energy in kind of recreating the wheel and maybe aren't able to just sort of fast forward as well as they might be able to if they had access to more mentorship, more just plain old paid consulting from other people in behavioral health to figure out how to do this better and how to access capital, how to go to the bank and how to get an SBA loan and things that would help them grow more quickly. I think they just don't know what's out there, and it's not easy to find.
So now, why don't we talk about the whole climate of healthcare now? We're in a strange climate for healthcare right now. I think that everything is consolidating, everything is becoming big and corporate, and is a small practitioner able to compete with that? The other thing that I have that I wanted to mention is that you talk about you don't get much from individuals going out and starting their own businesses. I see that in almost every field. People seem to assume that they have to be someone's employee, whether it's doctor, lawyer, candlestick maker. So how does that trend fit in with what you're saying? And how does the trend for huge corporate healthcare apply to women-owned corporations?
Well, I think that for behavioral health in particular, one of the things that has concerned me is that the workforce for the industries of education and healthcare, the workforce for those industries is made up, 75% of that workforce is women. To my knowledge, those two sectors have more women in the workforce than any other sector out there. So if you have a healthcare services firm, you're in an industry that is dominated by women in the workforce. And we're seeing this in doctoral degrees, too, women coming out with PhDs and PsyDs out of programs. It's a little more now, I think, than 2 to 1 women to men. So, and that's true across a lot of graduate programs, medicine, law. We're seeing more and more women getting those advanced degrees. And so in the healthcare world, though, what you're seeing is these larger and larger organizations and healthcare groups buying up other ones and merging. And most of those are being led by men. And I think and that does not represent the gender makeup of our industry or our sector or profession. And so
but couldn't you say
I'm hopeful. Go ahead.
If I could interrupt just a moment, couldn't you say that most of these huge corporate entities that are buying up other corporate entities, whether it's electronics or healthcare, are run by men? So why should healthcare be any different, I guess?
Well, I think that healthcare should be different because it needs to reflect and represent, I think, a little bit better what is really happening in the industry, which is that women are providing the large proportion of direct care services. And I think that something is lost in translation when you have, let's say, an MBA running your hospital or your organization, or even an MD. And certainly the MBAs, MDs bring very important skills and information to the table, but they don't bring all of it. And I think that in the absence of having people who are providing the direct care for the larger industry, having those people sitting at the table, helping make decisions about where healthcare is going, about what's working and what isn't, I think that something is lost there. And women just are not typically stepping up into leadership roles in general, and not pursuing ownership of groups, or if they are, their groups are staying small. And I guess what I'm hoping to see is that rather than have these large organizations keep gobbling up practices, which is one of the things that's happening out there. I get calls with some regularity from private equity firms that are calling, and they're calling a lot of other practices, trying to buy them up and make bigger and bigger groups. Now, we're not for sale, and I hope a lot of other women practices are not for sale. But
just
I just see a couple choices. Yeah.
My own personal philosophy is I think big isn't better, especially when it comes to things like healthcare. I want someone who knows my name. I want someone that I can have a relationship with. And what I've seen in the last couple of years with healthcare in general is that that's non-existent anymore. Exactly,
and I think that especially with behavioral health, getting larger and larger is not always a good thing. I do think we can be too small, though, and too small to have the kind of influence that I think we need to have. In particular, psychologists and people providing direct service, that we need to be large enough to have a voice. And I think what is happening is we have a lot of very small people out there, not connected in any kind of business way, not connected in any kind of social way, and that everyone is marching to their own little quiet drum. And I would like to see much better connection across all of the women out there running groups. And just statistically, it would seem like this was true, although we do have our societal biases and men tend to run more businesses. Given how many women work in healthcare, it does seem likely that we're going to have more and more women owners, just by the sheer fact that it's mostly women providing these services and coming up through our graduate programs. So I would like to see our women groups get larger, maybe not massive, because I do think a lot is lost in the personal connection and the personal touch that you're talking about if you get too large. But I think that too many businesses that are women-run behavioral healthcare businesses are too small to register on the meter and to have an impact in the direction of healthcare. So I'm hoping that more women will start businesses and make them bigger and connect, so that we all have a voice that's ringing out in the same direction and having an impact on the way that our clients receive care.
When I was, and again, this was 100 years ago, but when I was even in high school, I grew up in a very small farm town, 50 kids in my class. It was very small. But, there were no huge expectations for higher education, but even if you were the guy in shop class who was getting C's, your expectation was that, okay, maybe I'll work in a gas station for the rest of my life, but I want to be the owner of that gas station. I don't see that anymore. I don't see that philosophy anymore. Do we lose something with that? Are we losing something by making everything so huge and so corporate? And where you said, well, we need to be big enough to have an impact, but where is that line? At what point can you still have the impact but still keep the personal stuff? And could that be the thinking that's keeping women from expanding so much, or part of it anyway?
I don't know that we know where the line is, but I'd like to find out. And I think to find out, we have to keep growing and getting to that point. And I think there's a couple distinctions here. And one is that you have behavioral health care departments in some large hospitals and facilities who behavioral health is some tiny part of their overall giant system. And I think in those systems also it's hard for behavioral health to have a voice. It doesn't generate the revenue and the profit that other departments do in the hospital settings. So I think often it just doesn't get the recognition that it deserves. And I think, that's an issue even at the large scale hospital size. I think that just the very large systems, you're communicating with people who don't necessarily do what you do. They don't have the same degree. They're not doing the same work on a day-to-day basis. They may never have done any of the type of work that you're doing. So if you have an MBA, running a department or running a hospital, even though they may be well-intentioned and wanting to understand what it is you do or why a specific need that you have is so essential to you and to your client, they can't necessarily understand that. And I think it's not just about size. I think it has a lot to do with just who's in charge. And I think if you have someone in charge of the behavioral health department or your private behavioral health group practice, if that person really understands the industry and understands the needs of the professionals working there and the clients that come in, I think you're more likely to maintain that personal touch and have a setting and an environment where people feel like they're getting what they need. So I think you could have a smaller organization and have it be led by someone who doesn't understand on a deep enough level what's needed and still not have the personal touch or the kind of effective treatment that you're hoping for. So it isn't just about size. I think that it has a lot to do with who the leader is and what their understanding of the industry is. So I personally think that if large behavioral health groups can form out there, hopefully most of them women-led, and keep people in the leadership positions who understand what is happening and how to run it the most efficient way, both from a business but also from a treatment outcome perspective, that is the better way to go, rather than being gobbled up by a large organization or being folded into a hospital where there's an administration that doesn't understand what you do and may not even care. So I think we can get big if we stay in charge of our own organizations, our own businesses, and really our own sort of professional destinies. And I think that's really at the heart of what I'm trying to get at is if we don't grow our own organizations to meet the needs of the public out there, to meet the needs of the primary care physicians who want to refer clients to us, somebody else will step in and meet that need. And most likely it's going to be a hospital or a very large organization who won't be able to provide the personalized service that we can as people who do the work, or necessarily as effective a treatment as I believe that we're capable of if we maintain our own professional identity within our own organizations. But we have to start somewhere, and I think that the place to start is in our own smaller organizations. And women have to develop these skills. We can't just walk in and, lead one of the major institutions in any city tomorrow. But we can start learning and running our own and growing those to a place where we are more influential and have a greater voice in what's happening in behavioral health care.
I do not recall a single class in any of my coursework in psychology, either at the master's level or the PhD level, that talked at all about running a business. Nothing.
No, and I think that's a real problem. I think that's a problem across. I think that's typical. Yes, I don't remember ever having a class like that, and I don't know of any that are out there. I guess they could be, but I think that's true of most of the professions, at least the ones that I'm familiar with. That the training is very focused on that particular skill or profession, and I think that people just think you'll go out and figure out how to do it, or that you'll get a job where
or you'll become someone's employee and they'll already know.
Yeah, and maybe that's great. And a lot of people prefer to be an employee, and they don't want to worry about the business. And owning a business or having a leadership position isn't for everyone, and not everyone wants to do it. But I think there are a lot of really smart, talented women with entrepreneurial energy who could absolutely start and run businesses, and they either don't have the confidence, they're not getting the know-how from their training programs, and I think that is the piece that I'm trying to address in collecting some data about who are the women out there who have figured out how to do this, and do they have anything to offer collectively all of the women who would like to be starting a business or growing the ones that they have. And I think women would do more if they had more support, if they had more role models. And I think we have to make up for what the training programs are not doing.
Yeah. What do you hope to do if you get enough women that are interested in starting an organization, kind of banding together along this? What would you hope to accomplish?
I would like to see, just in a really practical sense, a very simplified way for all of these women to communicate with each other, to be able to, ask questions and find, if you want to get in a really grand scale, if it was a large enough organization, to have annual meetings where they can go and maybe have workshops on things that are helpful, from accounting to marketing to evidence-based practice, whatever interests them, and that is a little bit more relevant to running a business in a group, because there are parts of having a business that are like having any other business, and they don't necessarily have anything to do with your specific profession. Payroll is payroll, no matter what you do.
You have to pay the taxes. You have to, do the payroll. You have, there's the whole shebang there. Okay, so right now you just put out the word. How long ago?
I think that email went out on Monday.
And you've already had 50 responses.
Yeah, I put it out on a couple of my own professional neuropsychology lists, and asked people if they were on some other list, if they wouldn't mind forwarding it. And then I'm a board member on our state psychological association, and I asked our executive director, Brian Doherty, we love, thank you, Brian, if he would send that out to the other state psych associations for me, and he did, and that generated a lot of response as well. But I was really surprised at the amount of people that responded and just how interested they are. And virtually every person that's responded said, I would love to know what you're doing with the data, if there's any way to connect and, find a way to do more with this data. Every single person that's contacted me wanted more. They didn't want to just give me a name and, say good luck with that.
So you're running a fairly large corporation, and now you're taking this on. How are you going to get the time to do all this?
Well, I'm gonna make the time. It's a personal interest. It's almost a hobby. So it's something that I would do in my free time, as I'm doing at this moment. So it doesn't feel like work to me to take this on. And I think a couple staff members that I have are pretty excited about this also, and want to help out. So we're going to find a way to do it, because I think it's important, and if not me, who, right? Somebody has to, to at least get it started. I think if you enjoy something and it feels like a hobby to you, then it's not work, and it somehow just seems to fit into your life easier.
Mm-hmm. Now, you said that when you were seeking input and advice or knowledge or whatever in developing your own business, you had to look elsewhere to other organizations, other places, other resources. What were some of those resources?
Well, one, to get more direct to behavioral health, I had to go to a man that owned a large group practice and pay for consulting. I didn't know any women in town that owned groups, or across the country for that matter. So the first stop was finding a man who ran a large practice in town, which was lucky, and I'm lucky that he was willing to. So, and I greatly appreciated that. But there weren't any women to go to for that. And the other thing that I've done, there is an organization called the Women Presidents Organization, and it is essentially kind of a CEO roundtable of women business owners. You have to have, as a service organization, at least $1 million a year in revenue to join it. But if you can get there, it's a group where we meet every month for several hours, and we essentially help each other, with information and guidance, and however we can help each other run our individual businesses. We're all in different industries, but there are many common issues and problems that you deal with when you run a business. But I think there's something missing, though. That's only 2% of women-owned businesses out there ever get to that $1 million mark. So 98% of the others don't have an organization like that to go to. And I think that's a place we're really missing something. There are some other groups out there. I'm also involved with the Center for Women in Enterprise, which is here in New England. It's a great organization that does a lot to help smaller businesses. It is trying to address that group of women that has gotten started with a business but has not gotten quite large enough to join some of the other organizations. And I think that more and more of these organizations that are designed to help women either start or grow their businesses are cropping up. And I hope that women will Google around and really try to search those out, because they are springing up more and more. And I think that I think it's really necessary. If you don't have a business background and that's not what you went to school to learn how to do, and even if it is, even if you know what you're doing, it is still hard to actually implement it and execute whatever great idea you have. Actually doing it is a whole other thing.
Oh, so absolutely.
You have to, so there are things out there, and they're becoming more and more. But it takes a very, proactive person to go find them. I'm hoping that once we get enough names and start compiling this, that we can start actually reaching out to many of the women that either contacted me or contacted me with the name of a group that they know is large in their state. That happened quite a few times. Somebody said, well, my group isn't that big, but this person owns a group that's a lot larger. You might want to call her. We do want to actually start contacting people and finding out, exactly how large is your group. People, there are some very large groups that have 50 and 60 employees, but a lot of those employees work 10 hours, and they're not full-time. So we really want to hone in and try to figure out how large groups are in terms of what we call FTEs, full-time equivalent. If you add up all of the hours for your staff and you had to make them all full-time, then how many do you really have? And trying to start getting a lot more data and information so that we can figure out who someone would want to go to grow. If you have 4 psychologists on your staff and you're trying to get to 10, you need to know who out there in the community has gotten there or has gotten past that number, so that they've already been down the road you're trying to go down. It won't do any good to keep calling people who are kind of your same size. So I'd really like to not just have a directory, but have a directory that has a lot more useful information so people can figure out where to go, or who is of a similar size and might be dealing with the same issues that they're dealing with. You hit 50 employees and you're dealing with FMLA. That's something that not everybody has to deal with, and it would be nice to be able to find somebody who deals with the same issues you deal with based on the size of your organization.
There's been a lot of emphasis recently on STEM, the science, technology, engineering, and math for girls.
Yes.
But and I think that's wonderful to try and get more girls into the sciences. But what about business? it seems to me that we don't really make any concerted effort to teach women business skills.
Mhm. Yeah, that's interesting. There needs to be a B added to that. Call it STEM
Yes.
B. And I think that's a problem. It's not helping women get as far as I think that they could if they wanted to. I think just in the years that we've been in business, because we have kept growing, I have needed to create management positions along the way. And I think that we have created 11 management positions for professional staff and for our administrative staff in these past few years. And we have filled those in, every single one of those internally. We've not hired from the outside for any management position. We have found women internally who have stepped up and who have exceptional leadership and management skills, even coming from no background whatsoever in that. They have been able to learn on their own, seek guidance from other people in the practice. And so I think there are a lot of natural leaders, particularly in the behavioral sciences. They're already coming to the table with a certain amount of knowledge about people and how to interact with them and emotional intelligence and the things that one needs to be a strong leader. I think it's built in if they want to pursue that.
And that's an interesting connection there, too, because throughout this whole discussion I thought, well, but not everyone has, just because they're an excellent psychologist doesn't mean that they're an excellent business leader. Just because they're an excellent business leader doesn't mean that they can manage psychologists. I mean, it does take a set of skills from both arenas in order to be good. And that can apply to any field, that where you have, I mean, how many of us have worked for corporations where they brought in some brand new shiny MBA who didn't have a clue about the business, but he knew business, right?
Right.
And that can be disastrous. So what part of this conversation is finding people who have the skills in both arenas so that they can bridge between the understanding the actual therapy, consultation, etc., as well as understanding those business skills, because it is a different set in some respects. Mm-hmm. And so what you're saying is that some of those business skills actually are endemic to the provider in this particular field. Is that what you're saying?
That is what I'm saying, and I think that the ones we're talking about in particular are the ones that are very difficult to train. Social skills and emotional intelligence, while those can be impacted with consultants and coaches, I think making someone a very savvy person who knows how to interact with people at a level that makes them a good leader is hard to train. But I think that so many psychologists and behavioral health providers, they have that naturally. It's what probably why they like doing what they're doing or why they're good at it. And so I think some of the skills can be trained, but I do think that an awful lot of psychologists come to the table with many of the soft skills that are hard to train. And if you find the person that has those soft skills, you can give them the knowledge and teach them how to use those soft skills. I think it's a lot harder to go in the other direction and have someone with a whole lot of business knowledge that is not very socially savvy or doesn't have the emotional intelligence to be able to work with a variety of people who function at different levels and have different needs in the organization. I'd rather, any day, I would take the person with the soft skills and teach them what they need to know, rather than take someone with the knowledge and hope that we can teach them, how to be more emotionally intelligent in the workplace.
How did you build your business to the state that it's at right now?
Well, honestly, I never thought it would get this big. In all honesty, it's not like I set out to make it this big. I did set out to start a group, probably like most of the women that I'm hearing from out there. And, it starts and you have 2 or 3 people and they get full and you need another one and you kind of keep hiring and you take on more office space. I think at some point, though, it happened for me, and I think it probably happens for most growing businesses, it doesn't take long before you really reach, you start maxing out the skill set that you just sort of inherently brought with you. And you either stop there because you don't have the knowledge and skill set to get bigger, or you actively start seeking that knowledge and those skills to figure out how to be able to keep growing and to be able to hire the people to do what you don't know how to do. So I think, I just started growing and hiring, and at some point hit a place where we were large enough, like so many companies, things didn't go as smoothly as they look. We certainly had our rough spots a few years in when we got big enough to need more management than we had, or more management than my personality really allowed for. I'm not a real hands-on manager, and I don't really enjoy it, so I personally didn't do it enough. I didn't offer enough management, and I think that created a lot of problems. But I did learn from that and realize that's not my forte. It's not what I enjoy doing. I need to find people within the organization that enjoy that and are good at it. And after some fumbling and some failing, we eventually found those people and had them start working with us to start being managers. And we had more and more. And as we hired more people, we needed more managers. And I think just over time, it has evolved into a really well-running organization. And I think that people are doing work they like. And I think that's just a big chunk of it. If you let people do what they enjoy and what they're good at, they're going to do it well. And actually, just a sidebar, there was a recent Gallup survey and about kind of why people want to work for women bosses. And one of the things it said is that women managers tend to be more engaged in the workplace than male managers. Of course, this is a sweeping generalization, but it's their data from their polling. And that employees who work for women managers are more engaged than employees who don't work for women managers. And so what that data is suggesting is that if you have an engaged woman leader, and they tend to be more engaged, and you have a lot of probably women employees especially working for an engaged leader, they're also more engaged. And you wind up with these hyper-productive work groups. And I think that I see that in our own organization. We have a lot of very engaged women managers, and the staff are very engaged. The last 2 consecutive years, we've been named a top place to work in Massachusetts by the Boston Globe, which was based entirely on confidential employee surveys. So the people working in our organization say that they enjoy it. And I think that so much of that has to do with having engaged women leaders who are working with other women and the men in our organization, and just creating a synergy and an energy that is working. But it has not been easy to get there, and it's taken 11 years, and it has taken some setbacks and failures and learning from mistakes for sure. And a lot of those mistakes I am sure I could have avoided had I had a mentor or some other role model to watch. And I really hope that we can create this directory so that a lot of women out there don't have to make the same mistakes or experience a lot of the setbacks that me and all of the people in our organization, have had periodically.
One of the things that attracted me to this whole concept of what you're doing, of trying to line up and support women-owned healthcare, is because, going back full circle to what we started out with, this is an era of corporate healthcare. It's the only way it can be cost-effective, it seems. And so we are going to be seeing more and more employee doctors, therapists, nurses, whatever, that we have perhaps in previous generations thought of as being entrepreneurs and being independent. You'd graduate from law school, you'd go hang your shingle. Well, people don't do that anymore. It's the era of corporate. And so as you were talking earlier about this huge percentage of women in the quote-unquote caring professions, education, healthcare.
Mm-hmm.
You know, I mean, and we've come so far, but it looks like we're still looking at the administrators being the men. And, you know, but how about something that's a little bit more representative of the actual workforce? Because not all of us have administrative skills. Not all of us are business managers. But it's not as hard as I think a lot of people think.
And I think that, women have more skills and talents than I think that they're aware of.
We're trainable. We're very trainable.
Well, and I see this time and again in my own workplace with, watching women. They just are more reluctant to take risks if they don't feel 100% qualified or that they know exactly what they're doing. They're less likely to do it, and I think somehow we have to find a way to do it anyway. To quote Nike, to just do it and try it and seek out help. You were just talking about entrepreneurs, and it just reminded me, I have no vested interest in this whatsoever, but at Babson here outside of Boston, they have, it's always rated as the number one entrepreneurial school in the country. They have a whole program on women and entrepreneurship and how even to be, it's a program I'm really interested in, and I'm hoping to bring some training into our own women staff from this program, is how to be an entrepreneur within the space that you operate in. Employees can be entrepreneurial in their own work, in their own department, and bring a lot of value to the organization and bring a lot more enjoyment to their own work. And so I think also expanding how we think about entrepreneurship, it doesn't always have to be that you own the business. It can be that you are bringing a creative energy that drives some sort of change or growth within an organization. And so I really liked that way of thinking about entrepreneurship, that it has a lot of forms and can come in a variety of ways.
Maybe entrepreneurship is more than just owning the business. Maybe it's owning what we do.
Exactly. And it's empowerment. And this whole conversation boils down to empowerment, empowering women to do work they like, empowering them to take the chances to do things that they actually would be good at. Economic empowerment is a huge piece of this, and a piece that I personally feel strongly about, that women need more economic empowerment and control over their own economic destinies. And so I think you're exactly right with that.
So I've really enjoyed this conversation, and I'm heartened by the work that you're planning on doing with this. I'd like you to keep us informed about it, and I think that the idea of being in control of your work life is something that really is important to all of us. And I'm really encouraged by this. I'm encouraged by what you're doing personally to do this. Well, Andrea, yes. I thank you so much for being with us today and to talk a little bit about what you're doing in the area of women-owned businesses and particularly in the area of behavioral sciences. It's a field that I think is just going to keep growing and growing, and there is absolutely no reason why women cannot take the helm of a lot of those.